So in this second screencast, talking about behavioural approach and person-centred care, I'm going to come on to think about what we understand it from a dietetic specific point of view. But firstly, I just want to think, well, why are we doing this? Why are we making this big focus on person-centred care? And the reason is that it's an effective way of working. So the evidence base that being person-centred leads to better outcomes and better care is increasing all the time. And it also, because you get better outcomes, people are happier, they're more likely to make the behaviour change, then that's a much better use of the finite resources of the NHS. So there's lots of these initiatives and documents that you will have seen, I'm sure many of them, that, there's a growing body of evidence and policy that says, actually, this is the best way to work. And all of them have this overall emphasis on engaging with people, patients, carers, and citizens. So it's thinking of that health promotion approach as well. And because if we're going to promote well-being, prevent ill health, we need to engage with people. And a person-centered approach is the way to do it. So it's generally believed now that this is the way forward if we want to support behaviour change and change the health of the nation. But what does it say in dietetics? So I just want to use one paper in particular actually to give you a bit of an overview of what we know from a dietetic perspective. There's far too much to read all the individual papers. But this review was published in 2017, and it's an integrative review. Now, what that means is it includes qualitative research, so the results of interviews and focus groups, for example, and also quantitative research, such as from cross-sectional surveys. And it's included the views of dietitians and patients. So it's not just one perspective, it's pulling it all together. So they've basically looked at all of, done the literature searches, looked at all of the literature that was about patient-centered care and in dietetic practice, and pulled that together. So it's global, it's papers from Israel, Australia, Canada, the US, UK, pulled it all together. And then just looked at what the themes are that are coming through from that holistically. And they've come up with 5 positive themes. And you'll find that a lot of the terms used here sound quite similar. So the first things are about establishing a positive relationship with the patient and the dietitian. So that whole idea of working together that we've already seen. They've labelled this displaying humanistic behaviour, so that's the demonstration of empathy. And the reason I've linked these top 3 together is because of the evidence shows that you have to be using effective communication skills to demonstrate empathy to develop that relationship. So from my perspective, those 3 really sit well together and they link. Then you've got this whole idea of individualizing and adapting care. And this comes from patients' approach saying, I want to be treated like an individual. I don't just want a pat answer. I want that explained to me and how it works in my life. I want it to be adapted to me. So that idea that we see in the policy that you've got to adapt care, you've got to individualize, is very much echoed by the patients of dietitians. The other aspect is about giving power to the patient. And this goes away from traditional dietetic practices I would have been taught initially years ago, where I was the expert and I told the patient what to do. This is about this whole idea of empowerment, which we've already seen. The idea that you help the patient to take control so that they can manage their condition. They have that power. So those areas all link very much with the broader literature on person-centered care or patient-centered care. But that's got patient views in it as well as dietitians. So it's very much relevant to us. And one other thing that is coming through very clearly in this literature, and I know from my own research as well, is that when dietitians feel they are under time pressure, they feel that they haven't got time to be person-centered. So there's that tendency to revert back to a more expert-led approach of saying, I think you should do this, telling people what to do. So time pressure, which I'm sure you recognise is a massive issue for us in the NHS at the moment, feeling shorter time for an individual tends to take us away from the very approach that we're trying to work towards. And that's a real challenge. So one of the other things that I picked out from the same paper was all of the characteristics that were discussed about whether you have patient-centered care or you don't. So if you look under the left column, you've got patient-centered care. What does that lead to? And that's been very clearly documented by the patients and the dietitians. I say across all of this research, it leads to better relationships. The dietitians have more confidence, so do the patients. They go away more confident that they can actually make that change. The advice is appropriate. Empathy is demonstrated and recognised by the patients, and it's seen as very effective practice. But there's that caveat of it takes longer as far as dietitians are concerned. What I really want you to take on board is what's in the right-hand column, are the things that came out from patients when there was a lack of patient-centered care. So these patients were feeling disappointed, feeling the care that they were given wasn't helpful. It didn't take into account their preferences, so they found it challenging. It didn't relate to them. They went away feeling overwhelmed and discouraged, frustrated. Sometimes they were feeling they'd been rushed through as if the dietitian was in a hurry and they didn't have time for them. They felt that what they wanted to contribute to that conversation wasn't heard, and therefore the advice wasn't relevant. And I think what we really need to think about here is, what's that doing to the outcomes? What's that doing to the clinical outcomes? What's that doing to the effectiveness of our practice? So think through that because, we may be in a rush, we may be under pressure, but actually if we're not careful and we don't maintain our patient-centered approach, what we're actually doing is becoming less and less effective. And we have a couple of self-directed tasks to do today that will also help you explore this a bit further. So just going back a little bit about the evidence and the policies, I just wanted to get you to think a little bit about what's out there. So we've known for decades that the skills of practitioners are really important in helping people change. So that's you as a practitioner, that your skills, your communication skills, your active listening is really important for supporting people. It's been recognised nationally for many years now, really starting with a NICE guidance on behaviour change in 2007. But since then, we've got a lot of other NICE guidance, Department of Health policies, Health and Care Professions Council talking all about, including a lot more than they have done previously in the standards of proficiency, the BDA curriculum, and that Health Education England person-centered framework that I showed you. So it's right there across the board in guidance and policy. The idea that we're looking at skill level of practitioners, again, is there throughout policy. And the views of patients. And I've just given you a couple of the papers there that are suggesting that these skills are really important for how well the patients are going to receive their care. And just to kind of add another little bit of evidence about what happens when people don't experience good communication. And one of the things that I found fascinating is that two papers by Tracy Parkin and colleagues have shown that If you don't have empathy being demonstrated in the consultation, the views of the dietitian and the views of the patients when they leave are not the same. They don't actually recollect the same content of the consultations. So you might be thinking the patient's going to go and do this, but the patient is going away thinking they're going to do something else. And clearly, again, that's going to affect outcomes and effectiveness of practice. If you don't build rapport, there's evidence that shows that people aren't going to tell you how they really feel or what's really on their mind. If they don't share that with you, you can't help them problem solve their concerns because you don't know them. So that's really important. And of course, you've got this overarching problem of people going away feeling less satisfied. And those are going to be people who go around and say, well, I saw the dietitian, but it was a waste of time. Or, it reflects badly on the profession. But also for the patients, it's going to really reflect very badly on their motivation to change behaviour and their capability. We're not empowering them, we're not encouraging them, we're not putting them in a position where they feel they can go away and make change. So it's really important that we think about that. So in summary, just a very brief overview of policy and evidence and all the other things. We need to be getting behaviour change in our service users in order to promote health. We need to be person-centred, not approaching them from a disease perspective. So it's person-centred, not disease-centred approach. We need to use our person-centred approach. We've got to have good communication skills. And if we have those good communication skills, then we can use them as a solid foundation on which to develop our skills further, such as with things like motivational interviewing. And there's a wide range of different skills and strategies that we can use in order to support behaviour change with our patients.